We're going to go through a quick Connecture training today, just to go over how Connecture works, and I'm going to go over how you can log in and access Connecture. We have Jack Urett from Connecture who will be doing a demo of how you can create a profile, view and compare plans, submit a scope of appointment, and submit an application. Then Alyssa Etheridge from the HPP team, Learning and Development, will go over a AHIP poll and how you can submit your AHIP certification through our broker university. Then we'll take any questions that you have on Connecture or AHIP or any questions you may have. So I will go ahead and get started. And if you guys could use the chat box to submit any questions, and we'll also, take questions at the end of the presentation. So just jot down any questions you may have so you don't forget. Okay. So logging into Connecture, we will be sending out a broker blast before AP starts on October 15th, so that you have the correct site link for Connecture. You can save that to your favorites and you'll be able to log on. Another way for brokers to access the Connecture site is to go to the broker landing page at medicare.healthpartnerplans.com, and you would click brokers at the top of the screen on the menu bar, and you'll be able to see a link for the Connecture broker site login. Okay, so all users will need to sign in using temporary credentials. All credentials will be in the following format. So it'll be your first initial and your last name. There's an example there. So if your first name is Lisa, last name is Smith, your login would be L. Smith. The temporary password, which is case sensitive, would be your last name with the first letter capitalized, 2021. So that example again would be Smith 2021. So after you log in for the first time, you will be required to reset your password. At that time, you can make it anything you like. Just make sure you write it down so you don't forget. But if you need assistance with accessing Connecture, gaining access or logging in, you can definitely email Medicare Sales Coordinator at hpplans.com. And if you need to reset your password, anything, just send an email to there. It'll definitely get to me and we'll get you in. Training materials will be available in the resources section in Connecture. We may also make those materials available in Broker University where you complete your certification. This video will be recorded, so you will have access to it to review any trainings or questions that arise during this demo and training. So everything will be recorded. Okay, so I'm going to go ahead and pass it to Jack Urett, who will go through the Connecture demo.
Awesome, thank you. Let me just share my screen here.
Mm-hmm.
Perfect. Well, hi everybody. My name is Jack Urett, Sales Engineer at Connecture DRX. Today we're going to be running through the new Plan Compare One broker site that you'll all have access to for this AEP. Throughout this site, we've added in many new areas of streamlined workflow, as well as many new key features and functionalities just to make it easier for you all to work for this AEP. What you are currently seeing on my screen is once you have logged into your broker site here, you will be immediately sent to the Search Beneficiaries page. So we have done a lot of research with both current clients as well as agents to really understand what they wanted to see within our system. And we do want to stress the searching of beneficiaries right off the bat. So if you have built out a profile, you could search on that profile and always pick up from where you've left off. However, if you do know you are speaking to someone that's new to your book of business, you can always create a new profile at the top of the screen. There is a fast pass option throughout the system. If you didn't want to create a profile and you just wanted to get right to the plans list page, at the top of the screen, we do have a plans button. If you were to select plans here, it would open up a window prompting you to enter that beneficiary zip code, and it would take you directly to the plans list page. Also, always in the upper right-hand corner, you will be able to view your name. Today, I'm working as broker test, but if I was to select my name here, I'd be able to go into my account overview. One very important thing that you will find within the account overview is your personalized shopping link. This is a copy link, so if we were to select copy link here, we would be notified that it was copied, and we could send that off to an individual in our book of business, and it would take that individual to a consumer-facing site where they could shop and enroll in a plan on their own. And if they were to enroll in a plan from your personalized shopping link, you as the agent would get credit for that enrollment. So again, that personalized shopping link is found in the upper right-hand corner under the account overview. We do want to stress the searching of a beneficiary. So if we were to come into the system and search on, say, someone named Mark, it would pull up every Mark in the system. As we do add more criteria to search on, that search will get more specific. But say maybe we're uncertain if the individual we're talking to has a profile built out. So we search on a first name, last name, date of birth, phone number, email address, and for some reason no results are found. We could actually create a profile off of the information we searched. So again, just another area of streamlined workflow for you all, where you're not rekeying in information you've already entered. Say I was to go ahead and maybe search on someone named Mark Smith. Within the search results here, we can see that there is one profile built out for Mark Smith. And if we were to select Mark's name, this is where we will go to his profile. You can access this profile page by searching a beneficiary, or again, by using that new profile button at the top of the screen. Within the profile here, I do like to stress to agents to add as much information as possible here, because information will pre-populate throughout the system. Specifically, when you get to the electronic enrollment form, you're not going to have to rekey in this information again. It will populate on the form for you. So as you can see, we've gone ahead and actually entered information here. On the right-hand side of the screen, we do have a call out to notes as well as tasks. So if there is anything specific you do want to save to this beneficiary's profile, that can be done on the right. And as we do actually move throughout the system, notes will start to pre-populate in here for you as the agent. Also within a profile, we will show a quote history. So any quotes sent to this beneficiary in the past, as well as enrollment history. So we'll actually have the ability to view a past enrollment. We could view that enrollment in a PDF form. And we can also continue on through an enrollment here as well. So say we got halfway through the enrollment form with Mark Smith here, and for some reason he had to leave the meeting. When we do have that follow-up meeting, we can always come in, search Mark's profile, come right down to enrollment history, and there will be a button that says continue enrollment. And once that's selected, it will take you directly to the enrollment form where you could finish that application and submit it. So again, just another fast pass option. Once we have gone ahead here, built out the profile, At the bottom of the screen, we can now continue on to collect the scope of appointment. We do have a few ways in the system to actually collect the scope. If you as the agent have your own scope of appointment form, you can upload that back into the system. You could print a consumer form and upload that back into the system, as well as we give the ability to send off an electronic scope either via email as well as text. So as you can see, the email address as well as phone number have pre-populated from the profile. And if we did want to say email the SOA, all we need to do here is select email SOA, where we would be notified back into the system immediately that that scope has been sent. I'm now actually going to go act as if I am the beneficiary checking my email and just show you what they would see on their end. And this is the email that they would receive. So, hi, Mark, I'm looking forward to meeting with you. And at the bottom of every email that does come from our system, your agent information will be attached. So if they are confused at any point in the process, they could give you a call, send you an email. Again, your information will be visible. Now, that beneficiary would select complete scope of appointment form, where they would be redirected out to the electronic scope. And here they'll need to check in a few fields. So the products they want you as the agent to discuss, their beneficiary first name, last name, an attestation at the bottom, and now they could go ahead and submit the form. Once that beneficiary submits the form, you as the agent will receive an email letting you know, hey, Mark Smith completed the SOA, log in to view that scope. So if I was to go back into your broker site here and just hit refresh on the screen, we'll now be able to see that the scope was completed by Mark Smith. And now us as the agent will need to go in and complete the rest of the form on the right-hand side here, where it will pre-populate your first name and last name. We'll need to enter in the initial method of contact, the plans represented during the meeting, an attestation at the bottom, and now we can go ahead and submit the broker form. Once we do submit the broker form, we can now see that the scope has been completed, and we can now view a PDF copy of that scope here as well. If we did say want to send it via text, it would operate almost the same, but that beneficiary would receive a text message to their phone with a URL. Once they select that URL, they'll be redirected out to their phone's browser, where they will complete the same scope and submit it. So giving multiple options for this AEP. Once we have gone ahead and collected this scope of appointment, at the bottom of the screen, we do have two options. We could begin to go in and add preferences on the beneficiary, or we could continue to plans first and get more of a high-level view before we start to add preferences. So I'll actually continue to plans first. This will take us to the plans list page. Here we do have many options as an agent. We can look at the different plan types at the top of the screen, different sorting abilities. So if we wanted to sort by plan premium, total estimated annual cost, star rating, plan name, those options are available. We could view an individual plan's details. We could add to quote a plan. We could add to cart and begin the enrollment process, as well as we could check up to 3 plans to compare side by side. As I did mention, though, this is just a high-level view of the plans. We can always begin to go in and add preferences on the beneficiary on the left-hand side of the screen by selecting Add Preferences. This will take us to the Get Started page. Here it will pre-populate the beneficiary zip code, what coverage type they're interested in, and then a subsidy level question. Again, what we do answer here will be reflected back on the plans list page. Next will be health status. So the health status is used to help us calculate estimated costs. It will not affect plan premiums at all. And we bucket this into 3 categories. So generally healthy, some health needs, and significant health needs. And we do supply the definitions to those right below for you as the agent to view, as well as age range. So if you have gone ahead and entered the beneficiary's date of birth within their profile, this age range will pre-fill for you. But if you haven't, you can select from this range here. So from this page, we are determining utilization of the plans. Next will be prescriptions. So we do have the ability to save a beneficiary's drug list year over year within our system. So building out that medicine cabinet is very important. We can use the smart lookup tool here. I know sometimes drugs can be difficult to spell, but if we were to start typing a few letters of a certain drug, it will start to pre-populate this window where we could select, say, Latensin, for example, where it would pull up the most common dosage as well as quantity, but we can make those changes here if they're taking something different. As well as if there is a direct generic available, we will show that direct generic and the ability to switch to that generic for likely savings. So if we did want to add the generic, we would select yes and add that drug into the medicine cabinet. I'll go ahead and just add a few more here for today's demo purposes. So we'll add the generic and one more. Once we have gone ahead here and built out the medicine cabinet, we can always come to this page and edit a dosage or quantity. We could delete drugs out of the medicine cabinet if they're maybe no longer taking them, as well as we can always continue to manually add drugs using the smart lookup tool. The last step of the guided help will be the pharmacy page, so it will pre-populate that beneficiary zip code. And if they do have a pharmacy they like to go to, we can select that here. And once we move back to the plans list page, we'll be able to see with those prescriptions we've entered, as well as the pharmacy, if they're covered or not for the plan shown. So we'll actually go ahead and now continue back to plans. Here we will still have the same option as we did before adding preferences, but now we can see those preferences on the left-hand side of the screen. We can always go in and edit any of these preferences by selecting edit, and it will take us to that specific page. Or there is another fast pass option throughout the system. Once you are working on a beneficiary's profile like we are now, their name will be shown at the top of the screen, as you can see here, Mark. And if we were to select Mark's name, a drop-down for each page of the system would show, so you as the agent can easily navigate throughout the site. Since we now have gone ahead and entered preferences, the plan cards look a little bit different now. We're showing 3 of 3 prescriptions are covered, the pharmacy's covered, an estimated drug cost, a total estimated annual cost. So showing a lot of information up front to you guys before you do dive into the specific details of a plan. As I did mention, we can always check up to 3 plans to compare side by side by selecting the Add to Compare checkbox. So I'll go ahead and select these 3 here and then hit Compare Now. This will take us to the plan comparison page. where it will check and highlight to show plan differences across the board in yellow, as you can see here. And we break out the plan details into a few sections. So costs, the plan benefits, as well as the preferences that we have added. So the pharmacy, we can see that the pharmacy we've selected is in network with standard pricing. The prescriptions we've entered, as well as there is a link out to the provider directory. So it will take you directly to HPP's provider directory there. From this plan comparison page, we can always add a plan to cart and begin the enrollment process. We could send a multi-plan quote, as well as we could dive a little bit deeper into a specific plan by selecting plan details. This will take us to a one-off view of that plan we've decided to look at, but there will be two other tabs at the top of the screen. One being prescriptions and one being total costs. Underneath prescriptions, we'd be able to see with that pharmacy we've entered, as well as the drugs, we could see a tier breakout. So where those drugs would fall, along with the costs associated with those drugs we've entered. Here we can also add or edit the prescription list, as well as switch to mail order costs if we'd like. And the second tab is total cost. So here we can see with that pharmacy we've entered, the drugs, the total estimated annual cost, and we could see a breakout by month, so where those costs will fall for the beneficiary throughout the year. So supplying you guys a lot of information to help that beneficiary make the correct plan selection. From plan details, you can send off an individual quote, as well as add this plan to cart and begin the enrollment process. As I did mention, we can send a multi-plan quote. That can be done from this plan comparison screen by selecting Send Quote. Or we can also send a multi-plan quote back on the plans list page. As I did mention here, we have the Add to Quote button. So if we were to select Add to Quote, it would pull that plan up into this top bar for you as the agent. And again, we can select up to 3 plans. So I'll go ahead and just select these 2. And now we can see those 3 plans in this top header. Once we have selected those to quote to the beneficiary, we'll go ahead now and select Send Quote on the right-hand side of the screen, where it will pre-populate that beneficiary's email address, as well as an area for you as the agent to write a custom message to the beneficiary. Once you've gone ahead, supplied this information, you can go ahead now and select Send Quote, where we will be notified back into the system that the quote has been successfully sent. Now, this is important because it is a CMS compliance rule. The beneficiary will receive 2 emails, one being an authorization code and one being the quote itself. But we do show that authorization code here, as well as back within the quote history on the beneficiary's profile. So if they are confused or maybe have lost their authorization code, you as the agent can easily assist them. Since we have now gone ahead and actually sent off the quote to the beneficiary, I'll show you what they would see. So we'll go check our email as if we are that beneficiary, where we've received that one email here with that authorization code. So they'll either need to write this down or copy and paste it. And then the second email with the quote itself. So, hi, Mark, I have a quote for you. Again, your agent information will be attached. Now that beneficiary would go ahead and select View Quote, where they would be taken out to a landing page. Not this one, this is just for demo purposes. But they would be taken out to a landing page where it will prompt them to enter that authorization code they have received, and now continue in to view the quote. Once they do get in here to view the quote, they'll be able to view a little bit more information than just those 3 plans you've decided to quote for them. They'll actually be able to view the preferences that you've added for them up into that point. They could actually go in and edit these preferences. Say since you last spoke to Mark, he's taking a new prescription drug. He can enter that drug himself, and it will be reflected within your broker site. And now Mark can go down and view those 3 plans you've decided to quote for him. He could view the individual plan details just like we did as an agent. He could compare these plans side by side just like we did as an agent. And he could add to cart and go through the enrollment process on his own. And if he was to submit an enrollment through a quote you have sent him, you as the agent would get credit for that enrollment. So this is a very popular method right now in the times we're living in with COVID. Having the ability to send off this information to a beneficiary, allowing them to digest it, and possibly make a plan selection on their own where you as the agent would still get credit. And if a beneficiary is sent somewhere in our system, like the electronic scope, as well as this quote, your agent information will be in the top header for them to view, as you can see here. So again, if they are ever confused, they can easily reach out to you as the agent. Say we've sent the quote to Mark. He's reviewed the plan details, he's compared the plans side by side, and he knows what plan he wants to enroll in, but he doesn't feel comfortable enrolling on his own. So he reaches back out to us as the agent and says, you know what, this Health Partners Medicare Special Plan, that's the one for me. You as the agent could select Add to Cart to begin the enrollment process. Before we do hit the cart, or before we do hit the enrollment form, we are sent to the cart where we could view the details of the plan we've selected. We could also change or remove the plan from the cart and select another. So just to stop again before we do hit the enrollment form. Once we've reviewed the cart and we know this is the plan we want to enroll Mark in, at the bottom of the screen, we do have 2 options as an agent. We could decide to complete and submit the form myself. This would be the option if you are, say, sitting face-to-face with a beneficiary. As well as this year, we will have the option to select Send to Beneficiary to sign and submit. This would allow you as the agent to actually complete the entire enrollment form for the beneficiary. And then once you do get to the last page, the review and submit, you could send off the enrollment form to that beneficiary to review the information and submit the application. So again, giving multiple ways to you guys for this AEP to get those beneficiaries enrolled and give them visibility into the entire process. For today, we'll actually select Send a Beneficiary to sign and submit. And now we'll continue to apply where we will move to the enrollment form. Within the enrollment form here, just a few things to highlight. At the top of the screen, you will be able to view a progress bar. So where you are in the enrollment process, how much left you have to complete. as well as a shopping cart on the right-hand side of the screen. So that will be on each page of the enrollment form. So just giving you visibility into where you are, or just giving you visibility, making sure you have selected the correct plan for that beneficiary. Now, as we do scroll down into the contact information, since we have entered a majority of this information within the profile, it has pre-populated here for us as the agent. If we did say try to move on to the next page of the enrollment form and haven't entered a required field, it will not allow you to move forward. So just making sure we do have all of that correct information. We do have areas of additional information as well. So if you were to say, or they maybe had a separate mailing address, if you were to select yes, that drop down would apply to add in that information. Once we've gone ahead here, reviewed the contact information, made sure it's all correct, we can continue on to the next page of the enrollment form, where we'll need to enter in that Medicare number. So I'll go ahead and enter one here. The enrollment period questions, proposed effective date, as well as some OEC file format questions, so prescription drug coverage, as well as Medicaid enrollment. Next would be the other information, so some additional employment information questions. Another link out to the provider directory here where you will have the ability to enter that provider. So if we were to just go ahead and enter one here. The ability to email off certain information, so whether you want to email off plan formulary, summary of benefits, evidence of coverage, as well as how they'd like to pay for their plan premium. So get a bill, electronic funds transfer, bank account, automatic deduction from Social Security. Those options are available to select from. We've now entered the review and submit. Very important piece of the process, just making sure we do have all this correct information before we do send it off to the beneficiary. So we have each page that we have completed broken out for you as the agent to view. So you could select this contact information drop down, make sure it is all correct. You can make any edits to any incorrect information as well. Again, each page will be dropped down. And now as we do scroll down to the bottom of the screen, we have the option to send to beneficiary. If we do select that option, as you can see, it will pre-populate that beneficiary's email address as well as phone number and give you the option to send off this enrollment form either via email or text. The email address as well as phone number have pre-populated from the profile. And for today's sake, we'll actually send it off via email, so I'll unselect text. And now we could go ahead and select send application. We now can see that the application was sent successfully, and it will operate a lot like a quote on the beneficiary's end, where they will receive one email with an authorization code and one email with the enrollment form itself. But again, we do show that authorization code here for you as the agent to view, as well as back within Mark Smith's profile here. We can see within the notes that we have sent that application via email and the authorization code attached to that enrollment. Since we have gone ahead and sent off the application to Mark Smith, we'll go act as if we are Mark Smith checking our email, where we have received that one email with that authorization code. So again, either they'll need to write this down or copy and paste it. And then the second email with the enrollment form itself. So, hi Mark, here's the plan we discussed. That beneficiary would then need to select view application, which would take them out to that landing page where they'll enter the authorization code and now continue into the enrollment form. Once that beneficiary does get into the enrollment form here, they will be immediately sent to the review and submit page, where they will have the ability to review the information that you as the agent have entered for them. So a very important piece of the process, they can check that information, make sure it's correct, maybe edit any incorrect information. They would next have all the legal terms, and now they'll need to provide that they are the person listed on this enrollment form, and they could go ahead at the bottom of the screen and submit the app. Once they do submit the application, you as the agent will receive an email letting you know, hey, Mark Smith enrolled in so-and-so plan, and you can now view a PDF copy of that enrollment back within the beneficiary's profile. But what you're seeing on the screen is a confirmation page. So if the beneficiary submitted it, this is what they would see, along with if you decided to say, if you were sitting face-to-face and completed the enrollment form, doing that there, you would be sent to this confirmation page as well. Here you could print off this page. You could email off this page, but if you have included the beneficiary's email within the enrollment form, they will receive a confirmation email. So this may be a good area to maybe send it off to a family member or spouse, as well as we could view the application details. So the date it was submitted on, the confirmation number, as well as the ability to view this application that was submitted in a PDF form. So that would take you through the broker process. Say we were to go back to the first page, that search beneficiaries page, and search on the profile we've just enrolled in. Again, all that information will save in here. We can now see that Mark Smith is an applicant. And if we were to select Mark Smith's name, we'll see some additional information within his profile. Again, that note has pre-populated for us on the right-hand side when we have sent that application via email. We can see that the SOA was sent to Mark Smith. If we were to scroll down, we can see that additional quote we've sent along with that authorization code. And now we can view the enrollment history. So the plan we've enrolled Mark in, the date this enrollment was submitted on, the confirmation number, as well as the ability to view this application in a PDF form. So again, throughout the site itself, we've added in many new areas of streamlined workflow, so the pre-populating of information, as well as that header navigation so you could easily move throughout the site, as well as many new key features and functionalities, so the ability to send off the scope of appointment, either via email or text, as well as the ability to send off the enrollment form either via email or text, just giving that beneficiary visibility into the enrollment process. So thank you guys so much for your time today. If you do have any questions, we can get those answered for you now. But really excited to get you guys in this system. I really appreciate it.
Thank you so much, Jack. This is Precious. We can go straight into the AHIP poll, and Alyssa just showing how to upload the AHIP certification form, and then we can go into questions. And please feel free to use the chat box as well to submit any questions you may have so we can answer them as we go along. But thank you so much, Jack. That was really helpful.
Appreciate it.
All right, so everybody should see a poll question appearing on the screen. And we are asking, have you uploaded your AHIP certification to the Medicare Broker University? So if you could answer yes or no, I know that there are some people on the call who have done this. So Jason, when we're done collecting the poll questions, if you can make me presenter, and I'll share my screen and just go through quickly how to upload the certificate.
Sure. So I'm going to go ahead and close the poll. I don't see any other responses coming in, so.
Thank you, Jason.
Sure, and let me make you presenter.
I do, thank you, Jason. And for those of you who have not yet uploaded your certificate, that is something that you do have to do with HPP. We're hoping to, in the future, have functionality for that information to be automatically submitted to us. It's not active yet, so in the meantime, you do have to take that additional step. And for those of you, especially the external brokers who are on the call, our broker university is what you used to take our training and to get certified to sell with HPP. So you should be familiar with how to access that site. I will say that now, as of yesterday, we put the instructions for uploading the AHIP certificate actually on your homepage. So if you log into Broker University, you'll see that right there as soon as you log in. But I'm just going to go through quickly what that will look like. So my screen is going to look a little bit different than yours. And let me know if you can see that, Jason. It should be coming up.
Yep, see your ePartners.
Yes, so for the brokers from the FMOs, your screen may look a little bit different, but what you will do is if you use the link that's at the top of your homepage when you log into Broker University, that link will take you directly to the Add External Training screen. So when you click on that link on your homepage, it will take you directly to this location, and here's where you're going to add your AHIP certification. So English is already filled in, so you can just type in enter the date that you took the training, and that would be the date. It should match what's on your certificate from AHIP. And then if you scroll down, AHIP is the option at the bottom for institution. And then the last step that you're going to take is you're going to have to attach your certificate, and you should be able to obtain a PDF of that certificate. So you're just going to go select the file. And I just use the job aid there. So once you see that, you go ahead and click submit. And then you should be all set, and you will see it here. And then HPP, we will see that pop up, and we'll review your certificate, approve it, and then you will see it show up in your completed transcript. And that's really all you need to know. So if there are any questions about that, you can put it in the chat, and we will answer that for you.
And Alyssa, this is Precious. I just wanted to jump in because I know we had a few questions about the training being recorded. This whole training, again, will be recorded and will be available in Broker University and also in Connecture. We will send out an email once that's available. We'll send out an email blast to everyone so you're aware of the exact location you can access the recorded training. Another question that I did receive earlier was, is there any type of testing environment or sandbox to kind of get familiar with the system? There is a sandbox. If you need access to that, you can definitely shoot me an email and I can get you access to Sandbox if you want to play around. You can also use the the actual site to take a look around at what you can do. But since you guys don't have access to that just yet, you can definitely play around in Sandbox. So I'll put my email address in the chat box for everyone to see. And if you need access, you can just reach out to me. But if there's any more questions on AHIP or Connecture, please feel free to put it in the chat box, or even shoot an email to me or Medicare Sales Coordinator at hpplans.com.
I did get one. I see one other question, Precious, or for anyone. Is there an iPad app that I can download? And yeah, basically that's the question.
I don't believe so. So, Jack, if you're still on the line.
Yep. So no, there is not. But what I can tell you, the site is fully responsive. So if you were working on a laptop or a tablet or have sent something via smartphone, the UX will render to that device type, so it will look clean on all devices. So this is within your browser, but again, it is fully responsive.
Thank you, Jack.
Okay, I'm not seeing any other questions on, coming to me privately.
Yeah. So,
like,
okay. Any
it.
more? No, I don't see any more questions on my end as well. And I think our the contact information is out there. So if anyone has any questions, feel free to reach out to us. Again, this training will be recorded and available. Anyone who needs access to the testing environment to play around with the system, shoot me an email. We thank everyone for joining and participating. So is there anything else, Alyssa, you want to add? I know we have also our training specialists on the line, Nayel, Oscar, who is our sales supervisor, I believe Mike Ray as well. So if you guys have anything else you want to add, feel free to jump in.
Precious, I just wanted to say that I thank everyone who has submitted their AHIP certificates, and we're hoping to get everybody's in within the next few days. So spread the word.
Awesome. Well, thank you, everyone. You get a few minutes back, and happy AEP.
Thank you, everybody.
Thanks, everyone.